Ci troviamo a Roma presso la Fondazione Don Sturzo per parlare di trapianti nel nostro paese, soprattutto per fare il punto su una nuova tecnologia che prende il nome di OCS, Organ Care System, che consente di mantenere e trasportare l'organo donato, cuore, polmone e fegato, funzionante in uno stato metabolicamente attivo simile a quello fisiologico. Questa tecnologia è già utilizzata in alcuni centri italiani all'avanguardia, se adottata su scala più ampia consentirebbe di aumentare in maniera significativa il numero di trapianti del nostro paese. Noi ne parliamo con Walid Hassanein, fondatore e presidente di Transmedics, che è la società che ha messo a punto questa tecnologia. Walid, let's start from the beginning. How do you decide to invent this technology?
It's very simple. I am a cardiothoracic surgeon by training, and I had to come up with a PhD thesis to work on during my training years. And I was fascinated by organ preservation for transplant and the severe limitations of cold storage. And that's where it started. I started applying the same concepts that we apply in open heart surgery, and that became the idea behind the OCS system.
So you decided to build this magic box. How it works?
It's very simple to make it simple and people to imagine. What we did with the OCS is we developed human physiology into a medical technology. We're the only technology that keeps organs alive and functioning outside.
So the heart, for example,
The heart is beating, the lung is breathing, the liver is making bile, and the kidney is making urine. We do that by perfusing the organ with warm, oxygenated blood as if they've never left the human body.
and where is available this technology?
It's available in the United States. We are the lion's share of the United States transplant market. It's available across Europe, in the UK, France, Netherlands, Switzerland, Austria, Czech Republic. It's available in Saudi Arabia, Israel, Australia, and Hong Kong.
Which are the advantages of this technology compared to the existing ones?
Sure. So the existing technology is cold storage, igloo box filled with ice. The advantages of the OCS are huge. We prevent the severe injury that occurs with the organs when they are deprived of oxygen, called ischemic injury. More importantly, we keep organs alive and functioning so we can optimize and improve their functionality and their quality. And finally, we can assess the organ viability for transplant. You cannot do that with the current technology. That's why we have high waste. More than 80% of donated organs go unutilized every year, leaving patients on the waiting list without any chance for survival. With the OCS, we've been able to bring more organs to transplant, both from DBD and DCD donors.
You have data demonstrating the value of the technology?
Huge amount of data that I will cover in my presentation that's already published in high impact journal like New England Journal of Medicine, The Lancet, and Nature. So we have huge amount of body of evidence that is built across the United States and in Europe, and it's all published data. So the evidence is huge.
How many devices are already available around the world, and how many transplant has been realized using the technology?
So devices, we have close to 600 devices across the world. But the bigger number and the most important number for us is we have been able to help more than 10,000 patients get their organs on OCS over the years. 7,000 of those were in the US over the last 2 years alone.
And now you are arriving in Europe, specifically in Italy. There are differences between Europe and the States in the way to conduct the transplant, so the technology could be immediately used also in our centers.
We are highly confident that the technology can be used in Italy because we have many of the Italian transplant leaders are very familiar with the technology and have used the technology in lung, heart, and liver transplant. The problems are almost identical. The issue is we don't have reimbursement in Italy. In the US, we have full reimbursement. So we are committed to bringing the technology and the services to the Italian market if we can find way to secure reimbursement.
There are HTA data, health technology assessment data, demonstrating the value of the technology.
Absolutely. This is why the OCS is fully reimbursed in the United States. CMS and commercial payers pay for the OCS. That's the most important and most valuable health technology assessment data. Is with the OCS, we can increase the supply of organs by exponential number of donors that doesn't exist with cold storage. That alone is huge reason to support the OCS.
Looking back at the moment when you started with the idea, how do you feel?
Um, I'm glad I was so naive at the time to say I'm going to do this, because obviously this hasn't been easy. It's been 25 plus years of very hard work, but I am glad I made that decision, and I'm extremely proud of being here, supporting our Italian leaders to hopefully make this technology happen in Italy.